everybody? Welcome back to Talking Teeth. We love to see your comments. We love your crazy comments. We love them. Just keep commenting. It's awesome. We don't care. We're having a great time, and we're here to talk about something everybody asked me. I get text messages. I got people coming in telling me, what do I do? How do I brush? How many times do I brush? What kind of toothbrush do I brush with? They drive me crazy, and it's the same answer. Keep brushing. And what type of toothbrush are you brushing with? And how many times are you flossing? And are you using like dental picks or stimulants or proxy brushes? You got to use these things to keep your teeth clean. Now, if you're one of the lucky ones that has absolutely no cavities, well, boo-hoo to you, because not everybody's like that, okay? People have crowns, veneers. Not everybody's as lucky as you. Perfect enamel, okay? Anyway, we're here with beautiful Yuliana Bravo, who is an expert in patient management and taking people to a higher level. She's an experiential catalyst of perfection. Yuliana Bravo, welcome back. Love to see you.
Thank you.
And now we have a special guest, a very dear friend of mine. We're finally putting him in the camera because he's that good looking. We let him out because all the ladies love him. Joe Pellicciari, is that right?
That's correct.
Okay, from what part of Italy?
Basilicata.
Oh, forget
Super
about
south.
it. Hey, how you doing?
But we'll start with una faccia, una razza.
That's right. That's all right. We're together. You and
One
me.
face, one.
You and me.
That's
Ferrari, Ferrari.
Feta cheese.
Nice Italian clothes. I put the Italian clothes on for him. Okay? This is what we have today. And we're talking about toothbrushes. You have this very special toothbrush to tell us about?
We sure do.
Okay, hold on. Now, don't give it away too fast.
Okay.
Let's go through the process. You wake up in the morning, you got to brush your teeth. Okay? You look at your girlfriend, you look at your boyfriend, you got to brush your teeth. Okay? You got to brush your teeth. As soon as you wake up, right there, brush your teeth, stop, don't say anything else. Okay. That being said, you have breakfast. Now, you can brush again, depending on what you had.
Depending.
Maybe you didn't have breakfast. Some people don't have breakfast. They have coffee. That's okay. You got to brush at night. So you got morning and night minimum. That's minimum requirements to keep your teeth. All right? Guarantee if you brush your teeth, you will keep your teeth. I can guarantee that. If you floss, you'll keep them a little bit more. You won't have cavities. And if you do all the above, you'll probably have the most clean mouth you ever wanted. And of course, for your loving partner, they're going to be happy too. Okay? So, on that point, I like to brush in the morning. I like to brush sometimes depending on what I'm eating. Joe, depending on how you're eating, you're gonna, if you have a pizza with garlic and pepperoni, you gotta brush again.
Do you have a date after the pizza?
If you have a date after the pizza, if you're working on patients, you better be brushing.
Better be fresh.
So that's my second brush time.
Okay.
Okay? And then at home, afterwards, after dinner, I get home, I'm gonna brush again. I'm probably gonna floss at night. I'm probably gonna use some peroxide with water. We recommend, right, Yuliana?
Yep, I'm a big
peroxide with water, 50-50. Rinse it after I brush. And then I can even do a little toothpick stuff with my little special Propr, the new one, Propr. This is amazing stuff. That's the only reason why he's here, because it actually works. And I've been using it for 3 weeks now. So I'm telling you from my own, I do this every day in the car. I'm sitting in the back room, my office. I'm constantly cleaning my teeth.
All day long.
No, I'm telling you. He gave me a 100-pack. I'm down to like 4. It's like, forget about it. Forget about it.
That's
it's
right.
The best
Forget
stuff.
about it. It is the best.
My whole career, I got to tell you something. My whole career, I've been telling people about proxy brushes. All my patients have implants. They got veneers. They got crowns. Proxy brush. That's been my go-to. I opened this thing. What did I sell you?
The best product.
What did I say to you?
It is what you said, and I almost don't want to say it because that'll sound like a shill. But you did say you were impressed by the brush.
I love it. And you know why I love it? Because I can use it like all day long, and it doesn't go like this.
Right.
And it doesn't rip and tear, and it doesn't kill my gum. It feels beautiful, the Teflon. What's the actual material?
So it's TPE.
What is TPE?
It's a polymer. It's essentially,
Polymer.
yeah.
No cancer.
No.
You sure?
Positive.
Okay, I'm all right.
So the idea behind it, just one of the reasons why you're able to use it the way you're describing, is that the taper is not so aggressive. So it only fits where it comfortably goes. It's not like you're forcing it. So
exactly.
I think that's why you're able to get so much use out of it.
Yuliana, what's your take on it? What kind of interproximal picker do you use? Look at this.
I mean, I love picks.
Look at this. Can we get a close-up on that?
I love that it's 2-in-1. You have your dental floss,
Right, you got
and then
the
you have the
dental floss.
pick, or you can use pick.
Now we had an expert patient who loves these little flosser things, And he says usually 1 or 2 times through a tooth and it rips.
Yes, it's so annoying.
Right, and then you got to get another one. What is this made out of? This is not regular floss.
So it is, but what we mandated from our manufacturer is that we wanted that to go through various, even if they're tight contacts, we want to be able to use that and not actually have the flosser break. What's the point of having?
What is the material? Because it's not floss.
It is.
But it's a special type of floss.
It's a little bit.
I like Glide. Between me and you, I like Glide floss. It's nice and streamy. It doesn't really rip that much. But this is something different.
There are elements of using those types of products where they will fray and sometimes you'll have it left between. This is actually just a strong floss, nothing really too out of the ordinary, but we did say we didn't want it to be able to fit that between tight contacts and not have it break.
Well, it does fit, number one. Number two, I've done it like 3, 4, 5, 7 times, and it frails a little bit after like maybe 30 times, but it never rips.
Right.
It never ripped.
That was a mandate. We had other iterations.
Which was incredible, because usually they rip, like 2 or 3 times they rip.
It's so frustrating.
Yeah, we had other iterations of it.
This thing is just, oh my god.
It's amazing.
Can I do this on camera? Oh my god. This is the best. It's just the best. I've been doing it all day anyway, so my teeth are clean. Okay, so where do we get this? Can they buy it online?
Yeah, so we're selling right now exclusively online through our website.
I'm not a product pusher. But
No,
this
you're
is
not.
So good.
I keep going. This is not a paid advertisement, but we're really happy that as a practitioner you see the benefit to the patient because a lot of what you're saying is actually.
We try that.
Oh. It's great what you're saying because it really goes in line with what our philosophy is. We want our customers really to utilize the pick before brushing. We're recommending 2 times a day. Standard, 2 times a day, 2 minutes a day.
It just goes in nicely.
It does. It's very smooth. It's my first time using your Propr.
This
So
is
I'm
like
excited.
real time.
She had no idea what we're going to be doing today. So she's just improv right now.
But again, we do want, because the statistics show, we won't get into the numbers because that's boring, but the statistics show that if you floss before brushing, you are going to remove more plaque because there is no toothbrush that really gets between teeth.
So how did you get into this, Joe? I mean, you were in education, you've been around the world traveling. How did you get into this?
I think the way that this why it piqued my interest was really that I was brought in as the product was going through various iterations. Obviously, as you know, in running clinics and seeing patients come back, you do see that there's a lot of patients that are in the dental chair due to some form of negligence. Right. Whether, and look, some folks drive around with a tire that has low air pressure, and then they hit a pothole, and now it's a flat.
Right.
Put the air in, avoid the flat.
Right.
Floss, brush, keep your teeth.
Avoid the problem.
Avoid the problem. So, for years I was sitting with practitioners who would tell me, especially in the endo area where I first started, a lot of those endodontic problems started from a small cavity. Yeah. An untreated cavity becomes an infection. That infection becomes a root canal. Right. An untreated root canal or root canal therapy becomes an extraction and an implant. Right. So you look at a small problem that could be largely avoided by just good hygiene. Becoming a very costly, very expensive problem.
I find that every time I ask a patient, we do it a very different way in our practice. We don't tell people, you better floss. We don't do that. I literally say to them, are you a flosser or are you not a flosser? No judgment. Because I need to know. Not because I want to insult them or anything, because I want to just say, okay, you're not a flosser, use this thing. Use a pick that can go in there. It's a lot easier. You don't have to sit there and ruin your mirror. I get it. It's a little bit sloppy in the middle of the restaurant. You can't floss in the middle of the restaurant. That's why I love this, because you could be at the bathroom of the restaurant and still do a little flossing, but this pick, to me, is an easier thing. So they said, the ADA did a study, 34% of the patients don't floss. The rest don't floss. Right. Oh, wow. So we say, okay, I can't push them to floss, but if I can just get them to use this little pick, to me, that's going to help them a little bit. It's like a rubber tip. The feeling is really smooth. I love the way it feels.
Firm.
It's firm.
I was just picking away.
I'm bending it all the way like this.
That is the material.
And it goes right back.
Right.
Look, it's right back.
That's the memory. So the product is developed with a specific durometer. I mean, we're getting really technical, but there is durometer and there's built-in memory to the product so that as you're using it.
I like this too. This is like just the way it feels. It just feels good.
The ergonomics are, they're there. That's a specially developed product for us that we felt was a real complementary piece, but really it's a critical aspect of your care. Think about it. That flosser is going to be great for tight contacts, but where food can get trapped and larger problems.
Also for implants. You can use the implant's a big deal, right? Our biggest problem in dentistry is implant dentistry, because the size of the implant is so thin, 4 millimeters, 3 millimeters, and the crowns are so big. the spaces are just so much bigger than between any teeth.
Right.
So the size of a normal molar is about 12 millimeters. The size of an implant is 4 millimeters. So you got 6 millimeters on between 3 and 3 on each side. That's open space. And this is a big product for the implantology patients who just can't physically get the food out. It's just too big.
Right,
and it just goes in and out.
We see our product line really being for patients who are trying to prevent problems, or for those who have undergone treatment and need to.
Well, it's got to work for both.
Correct. So we believe that we find like this happy medium between all of it, where the brush, the picks, everything is for prevention, but also if you've already been down that road.
Let's talk about this toothbrush. How do I
Quick
open
question.
it up? Open it up for me.
Is there a rule in how to use this? Should we be picking or flossing first?
So you're going to want to use.
What's the rule? That's a good question. Should we pick first and then floss?
Or should we floss and then pick?
So again,
No, let me think about that.
the
What
product.
do you say?
Okay, so the product is developed by a periodontist. Okay, so everything that we're doing is based on over 50 years of clinical expertise. What he recommends is actually you're using the flosser where it fits, and you're using the pick where, or the interproximal brush where it fits.
Okay.
Never jam it in and find
Right.
a tight spot, because you actually might be creating a little bit of a problem. So
Right.
you want to use
So if
it.
it's too tight, you can't push
For
it.
instance, in my teeth, doesn't fit.
Yeah,
I have very tight contacts
Right.
back here.
But it fits fine.
It's
Well,
fine.
that's usual. You know, anterior teeth, they usually
So
typically
we're
don't
recommending anterior teeth. You want to use the flosser side.
Right.
Posterior, the interproximal.
Yeah, that makes sense.
I
That
just
makes
learned
sense.
something. I
Yeah,
sometimes
because-
force
yeah,
it.
Yeah, because a
No,
lot of
you
times on the
shouldn't force
front teeth, the teeth are very tight, the
Yeah,
contacts are tight, you
I
can't
force
really
it
get floss.
sometimes. Well, I
Yeah.
force the pick. What
Yeah.
happens now? So let's say I've been a pusher.
Yeah, but don't push it. Don't do it
push.
again. Don't do it again.
So this
Okay.
is a common theme that we're finding, especially in, let's say when we did our market research or we do any kind of clinical trial. We realize that a lot of this is happening through some unknown negligence, right? And I relate it when I'm talking to people who don't understand what I'm doing. I say, you know, my dad taught me how to shave. And when he taught me how to shave, he said, Joseph, to get close and have a really nice, which I don't do, as you can see, to get close and have a tight shave, you want to go, and it's the worst thing, shaving in the opposite direction.
Well, first you shave down, then you
Well,
shave up. You do two.
Some
I
people
do
say
too.
don't shave up at all. Because
No,
now
you
this
gotta
is so now you have this thing where he's not an expert, he's not a barber of Seville, and
Right,
he's
right.
doing this every day. He's teaching me what he knows best. And
Right.
a lot of these practices, they happen at home. Parents are teaching their kids
What they know best.
what they know best.
Not
They're not
really.
necessarily dentists
Correct.
or practitioners
Correct.
who really can advise them.
And that's why this is important today, ladies and gentlemen, with kids and dogs. We had a vet come on. They're not brushing the dog's teeth.
I have to
You
be
gotta
honest
brush
with you,
the dog
I
teeth.
brush my dog's teeth
You
with
gotta
this brush.
This is the greatest brush.
I don't want, it's not for dogs
You
necessarily,
have
but I
to
do
learn
use
the
it.
right way. And yes, the protocol is very important.
Right, and so I think what we're trying to do is really try to build better brushing habits, and I think that's really where it's at. You know, if you are brushing well at home, taking good care of your teeth, at your next hygiene visit, you're probably going to have a better result.
Yeah.
And if you have a better result in the hygiene visit, there's less likelihood that they're going to recommend to the doctor some sort of a procedure.
Right.
Ultimately, how does that help you? It saves you a few bucks as you go through your oral care.
It just makes you healthier.
Correct.
Tell us about this. This feels so cool. I want
So-
to give Yuliana one. Take it out.
So
This
re-
feels so cool. What are these These bristles are so
we,
different.
We
What is this
actually
made of?
refer to these as our super soft scrubbers.
What
we're
is
not,
this?
yeah, we're not really calling them bristles, but it's a TPE. We won't get too technical in what the material is, but the idea behind it is to move away from nylon.
Feel this.
If you run your thumb across it, you can actually feel a real difference versus
Yeah.
the nylon. You know,
Yeah.
Yeah.
a lot of people, and we won't, again, no numbers being thrown around because it varies where you look, but most people are hard brushers.
Right.
And as you know,
Right.
I'm a big workout guy.
Right.
I love to lift weights heavy, and I'm pretty strong. I doubt anyone's really doing that when they're brushing their
Right.
teeth.
It's really
But
pushing.
check
That's
this out.
what I hate. I hate when you get a toothbrush, and about 2 weeks, a month later, it's all frail, and I go
Right.
get another one.
So
maybe
right,
I'm
Does
not
that
that-
happen with this brush?
we've been pressing on it, and we can manipulate it right back into position.
Got it.
Because
got
it's there to
so
absorb.
the memory is there.
And it's there to absorb the pressure, right?
Okay.
As you're brushing, and
Well, that's what we find with older patients. Generally speaking, patients after 60 years old usually have recession. Recession means that the gum has opened up beyond the enamel and it's on the root surface. The enamel is the strongest particle in your body. It's the strongest. The second strongest is underneath it, called the dentin. The weakest part of the tooth is the cementum, which what is shown when you start receding. If receding gum line, the roots are shown. Now you get a hard brusher who starts doing like this, and what we see is this called toothbrush abrasion of teeth on the older population. I'm going to give you an extreme example. There's a patient who's 89 years old in my practice. He's been brushing his whole life with a hard toothbrush. You know what his teeth look like? The teeth are beautiful. The roots are all indented. And then one day he bit down, he broke the tooth.
Oh, gosh.
Didn't have any pain. He's like, Doc, I broke my tooth. I said, you have no pain? No. Because the brush has taken away the whole root and there's no nerve. The nerves receded.
So they're exacerbating the problem, right? I mean, you have this probably inherent issue, dental issue, where they might have a natural recession of their gums, time, age, whatever, and now they're using the wrong brush or brushing incorrectly. That's really what the product is really supposed to try to curb and eliminate is, you know, there are folks that still use a hard bristle brush. You should never use a hard bristle brush, according to many.
We always recommend the soft.
So what we designed
here. This is extra soft.
Yeah,
it actually looks like, it feels like it's really pushing.
So we call
harder.
we call them super soft scrubbers. We're not referring to them as bristles because bristles are what you find on a nylon brush.
Right.
Again, there are going to be some folks who use a nylon brush and prefer that sensation. We can't you know, really promote that nylon is, but there are studies that show that nylon is more abrasive than this product. So what we're trying to do is, in the demographic that we're targeting, we want them to understand we're really looking out for their best interest. It's prevention also for those who might have gotten a $3,000 procedure, a gum graft, or they're in line for implants. Let's protect that investment as best we can.
100%.
And that's really what the product's geared to do.
Well, I've been using it now for 3 weeks. It's on my counter. It's in my bathroom. I love it. I like the ergonomics of it. It just feels good. Now, I know it's expensive. It's a little bit more than a regular toothbrush.
Yeah, so what we're figuring is, you know, per brush, it amounts to about like 8 cents of brushing. It's not much. If you can spend 8 cents to brush your teeth and it's going to stave off a $3,000
well, but also
procedure,
you're not going to have to keep buying another one. So it's one, if there's like $8, $9, most brushes are I think $8, $9, $10.
Right. So
and you're about what? How much is your brush?
$14.95.
14. Okay. So if I use this twice as much as the other ones, it's about the same cost.
Correct. So the idea behind it is that the brush will, you know, give you the same level of clean with the same gentle protection that we're looking to deliver. I mean, that's really what the brush is all about.
Yeah, and I'll be honest with you. When Joe approached me with this, I said, absolutely, I'm not doing anything unless I have proof. So what we've, you know, because I don't give patients stuff that I don't really try out myself, and at least I give a good evaluation. So what we did in our office, we have about 100 brushes that he gave us, and we gave it to our patients with an evaluation form, and they're literally emailing back now. We haven't figured out all the things, but we're at about 87% acceptance right now from what I have. But when I get all the 100, I'm going to definitely post it. And I needed to know that for my own patient. So it's hard to tell a patient, go buy this toothbrush, if we don't have any evaluation process. To me, that doesn't make sense. Anything we do in the office has always been evaluated with patients, real live, and our families and everybody that we know that tell us the truth, what's going on. And like I said, so far we're about 87%.
Yeah. And that's in lockstep actually with the results of our market research. It's funny that you're mentioning that number. That's when we did our market research and we had our cohort, the response rate was so overwhelmingly positive that the folks that ran the study, they came back to us and said, we haven't seen results like this in a while.
Right.
And we thought that they were kind of pulling our leg, but then when we got the results and we looked at it, I like to mention this one. You know, we pulled the cohort and we asked them, are you a parent? Of the respondents, only 23 were parents. Of the 23, we asked them, hey, would you buy this brush for your children? 18 of the 23 said yes. Now as a parent, you want to always get your children the best thing possible. And that reaction to me was really favorable.
My sort of number in my experience has always been 80%. You know, so anything over 80% is very good in our business in terms of a new product acceptance and a new product trial. There's always going to be a 10% absolutely no's, right? So you have 10%, so you're at 90% right away. Now you have 90 to 80. So yeah, maybe 85, 86, 82. I have no problem with it. But anything over 80 in my evaluation process, when I do a filling, when I do different materials, when I see 80%, over 80%, that's good enough.
Right.
That's a very good result for acceptance of a new product.
Speaking of 80%, about 80% of my day I'll be holding the brush in my hand. and I catch myself, sometimes I'll be on a meeting and I'll be speaking to somebody about the product, and then I catch myself doing this with no toothpaste. And I sit there and I'm brushing my teeth.
Well, that's another thing you told me, and I didn't believe it. So he said to me, Dean, this kind of brush, you don't actually need toothpaste because you don't need as fuzzy. By the way, the toothpaste is there. It's called Propr Toothbrush. It's no SLS, right?
Correct.
So that big thing about toothpaste, everybody should know, this is the true reality, they don't want to tell you. SLS is a product that's like in soap. It makes it fuzzy and suzzy, right? That's the feeling that we're used to with toothpaste. You put a little bit of toothpaste and it makes this big foam and it feels good in our brain. Somehow they figured out we want soap in our mouth with that taste like mint. So I'm a non-SLS person. Anything that has SLS, I'm out of it. So when he gave me this, I have my own toothpaste, which I think we want to start partnering with.
Right.
I don't want any SLS in my mouth. It's bad. It causes sore, cancer. I don't know. I don't like it. I don't want it. It's bad. So I was very happy to brush without toothpaste. I was very happy to brush without toothpaste.
I catch myself doing it all the time.
It was like, for me, I was like, yeah, why do I need toothpaste?
Yeah, it's
and
interesting.
If I'm going to have toothpaste, okay, it's mostly for the taste. Like, you just want to have fresh breath.
So this is one of the things that we find, and you used it for the first time, but I think one of the challenges that we find is that many of our customers have been using exactly the type of toothpaste you're describing for 40 plus years.
Right.
And their expectation is that ultra sudsy, and we're fighting that feeling. There is an adoption period to everything. This requires commitment. It requires an adoption rate, and you have to just be consistent in using it. We find that after 2 weeks of consistent use,
it feels really great.
Yeah, it becomes the norm, and what ends up happening with the bristles is the more you use it, the more comfortable you become with it, the more accustomed you become to it. And it's about 22 days to make a habit, right? That's kind of the old rule of thumb.
Is that what it is?
Yeah.
That's theoretically, that's what they say. Do something consistent for 22 days, it becomes a habit.
Okay.
We really believe that after 2 weeks of use, you really start to get more accustomed to the sensation. And I think the initial shock after using a nylon brush for so long and experiencing that abrasion for so long, it makes this feel like it's out of the norm, right? It doesn't feel right.
It doesn't feel right.
But you get accustomed to it very quickly. We encourage our customers, after they buy it, use it for 2 weeks, give it a shot, give it a try. If you still don't like it and you like the abrasive feeling, that might just be innate to that particular person.
No, listen, you're never going to get 100%
correct.
adoption rate, but I'm happy to be recommending it. I've been using it. I'm happy to doing it. And again, I'm a hard critic. As soon as you told me toothbrush, I'm like, I don't want to hear about it. I was very negative because I don't like new stuff.
And
I
spoke
like
to
to
you
stay
about
my own way.
Yeah.
But I just said, let me try it. And then, listen, I wouldn't have you here if I didn't believe in it. And
Appreciate
you know me,
that.
I just tell the truth all the time. This is a new product. They can go online and find it?
Yep, proprdental.com, Propr dental.com.
Okay.
They can follow us on Instagram. We have all of our socials, and we have interesting content for everyone to view.
I'm excited to try this.
Any comments?
No, it reminds, so I transitioned from washing the face, us ladies, we may have so many different products.
Yeah, for
but
skin.
For skin, and there's one that I don't know if it's the same kind of product, but it's not a plastic.
Right.
It's not something that's rough. It's not a brush, because when we grew up, it was like a brush that you can also.
Right.
So I'm excited to try this because I'm a huge believer on my skin and using the softer bristle, it's not too damaging. So I could imagine, because I have brushed very hard for many years.
Well, we have
so
plenty
I'm
to give you, so we'll give you one
this.
to take home.
Thank you so much.
I
But this was fabulous because I already
That's
tried this
fabulous,
today.
right? Yeah,
This
Thank
was
you.
great. So I
So
can't wait.
we like that. We like the analogy about skin and soaps, and the last thing that we really always like to talk about is, I'm a car fanatic. You know that. I'm crazy about cars. Would you wash your car with your broom from your house? Probably not. You use a nice microfiber cloth and you clean it really nicely. Why are you using abrasive material on your teeth? And it's
Well,
the
I
same.
told Joe, one of the things I wanted to see, and hopefully this comes out in the next couple months, I wanted to see a side-by-side study of the nylon for 40,000 or 50,000 rubs and see the difference about this one and see what the difference is. Because if we have that before and after, that's a powerful message.
So actually,
to everybody.
we're conducting a research project that's going to simulate over 30 years of brushing, and we're going to pair this against most of the conventional nylon toothbrushes
That's great.
and try to see what the
So I
wear
think that's a
level will
big
be.
win. For me, for my product, my patients, like that's a big thing. Everybody wants to, the ones who brush, they brush hard,
Right.
right?
Yeah.
And if their toothbrush is frail after 2 or 3 months, they need a new toothbrush. If their enamel is being worn and their cement is being worn and their roots abrasion, that's a problem. It's
Correct.
a serious problem.
I think, as for me, thinking, like, I believe that if I'm brushing harder, I am cleaning
Right.
properly. Right? It's
Right.
like the thought process of it. It's
Right.
like, oh, I need to be like, let me get
Harder.
back there, you know?
Yeah,
Like,
you go harder.
yeah,
Yeah.
like just to brush. I
Right.
mean, I don't think I'm super rough where my toothbrush
So-
is bending
So
permanently.
you could actually
but
brush your
still,
teeth with only 2 fingers of pressure.
Really?
You don't need to apply much more
Well,
pressure
I
than
think
that.
that was the quote unquote learning curve for me. 'Cause I'm
Wow.
like, I don't feel like I'm cleaning.
Yeah.
Yeah.
So then after what I did was, and again, I'm Mr. Critic. I brushed very, very gently with no toothpaste, by the way. And then I took my scaler, because I have a scaler at home. If anybody wants
What's a scaler? What's that?
That's a dental instrument to clean your teeth.
Oh, okay.
We don't give it out to patients because they could kill themselves or kill their partners. So we have a scale, and I scale my teeth. I go, let me see if there's any plaque on my teeth. So that was my test.
Well, we like to
And
do.
I didn't have to brush hard.
So we can't give out scalers because of what you just mentioned. But what we do like to do is to some customers who are just feeling like they're not getting clean, we do like to send them disclosing tablets, and we actually encourage them to utilize the disclosing tablet to understand that it's not necessarily the product or the tool. The tool is a major player in how well
Right.
and how clean your teeth
Right,
are.
right.
But it could be your technique. Let's
Right.
use the disclosing tablets. Let's show you where you might be
So
missing.
disclosing tablets are little red tablets that you take to see where there's plaque. If a surface is clean, it's not going to show up on the surface. If a surface has plaque or any kind of debris, it's going to show up dark.
Sign me up.
So that's more of a testing to see if they're
Okay.
brushing correctly.
Correct.
Has nothing to do with the brush. It has to
Correct.
do
Yeah.
With the technique. So yeah, there's people who just go like this, they brush and they think they're
Right.
clean. And that's why I think I like to brush, then do the floss, then do the pick,
See,
then rinse.
Yeah, we recommend the
peroxide.
opposite. We recommend the removal because the
You could do
pick
that.
and the flosser removes.
Well, that's the macro. It's
Right.
the macro removal, and then the micro removal. Yeah. So anyway, listen, I'm very proud of you guys.
Thank you.
I'm happy that you did this.
Thank you.
I believe in you. I believe in the product.
Appreciate that.
And listen, time will tell.
That-
At
fingers
the end of the day, patients make the final decision.
That's right, and we hope that they choose it for their own well-being and their own health,
Yeah.
and that it becomes something that they adopt into their daily practice.
Right. Okay, great.
Appreciate
Great
that.
to see you guys. Hope to see you soon. Maybe you guys have a mouthwash next time with no SLS.
There's a lot coming down the pipeline. There's
All
definitely
right.
a lot of
Awesome.
products.
Great to see you guys. Thanks for being here.
Thank you.
See you soon.